Welcome to TCCC-Plus Day 2, Module 14, Nursing Care. This module covers the nursing of a long hold: clean, warm, dry, turned, fed, recorded. Everything on Day 1 was about the first hour, while Day 2 teaches more about the enemies that arrive on Day 2 and Day 3. A part of this is traditional nursing challenges and skills: pressure sores, a mouth drying out, eyes that will not close, limbs stiffening, clots forming, a casualty who has not passed urine. None of them are immediately dramatic, but every one of them can undo what you have saved. On a long hold, nursing care is not extra work on top of the treatment, it is the main treatment. A casualty who is turned, clean, hydrated and moving travels better and has a higher likelihood of surviving. Pressure sores are an important problem in longer-term care. Skin dies where weight sits. On a litter, a casualty who cannot move starts damaging the skin over the sacrum, the heels, the shoulder blades, and the back of the head within hours. And a pressure wound in the field is an infection door you opened yourself. This is particularly high risk in people who have risk factors like old age, underlying illness, and, relevant to this course, blood loss and hypothermia. The counter is simple and free. Turn them. A third turn to each side roughly every 2 hours and pad the points that carry weight. Folded clothing does fine. Check the skin every time you turn. Redness that does not fade when you press it is the first warning, and it means that spot carries no more weight. The clock runs on the skin too. Heels, sacrum, elbows, the back of the head. Anywhere bone presses on a surface, tissue dies if it is not turned. On a long hold, keep reposition on a schedule. A pressure sore is a wound you caused by doing nothing. Naturally, an unconscious casualty cannot blink, swallow, or spit. The mouth dries up, cracks, and grows things. Moisten it, clean it with gauze on a finger, keep the lips greased. The eyes are the quiet casualty. If the lids do not close fully, the surface dries and the cornea ulcerates within a day. Check that the eyes are closed. If they are not, close them and keep them closed. A strip of tape does it, and keep the surface moist. Overall, movement is an important part of our lives. A body that does not move makes extra blood clots, stiffens, and pools its secretions. Try to get the casualty moving a little, ideally putting every major joint through its range a few times, gently. It helps keep clots at bay, keeps the joints soft and not stiff, and can be done while doing a hands-on reassessment anyway. If they are awake, have them do it themselves. Breathe deep, cough, wiggle, shift. Stillness is comfortable, but it is a hazard. What goes in and what comes out is a vital sign on a long hold. In. Fluids by mouth if they are awake and can swallow, small and often, and food once the hold stretches. Out. Urine is the one to watch. A casualty who is not passing urine is underfilled or worse, and you should always know when they last went. Bowels start to matter by day 2 or 3. Track it all on the flow sheet with times. The trend is the message, and someone will ask for it at handover. For you, this module is awareness and the basics done well. Turn, clean, moisten, move, track. The structured tools sit one level up with the combat medic. Hitman is the CMC's daily care plan, and sheep vomit is the CMC's bedside nursing checklist, running from skin protection through to turning and breathing exercises. Know the names so the handover makes sense. Do not try to run the systems. Your basics are what make their tools work. Leave with this. Turn them and pad them every 2 hours, skin checked each time. Mouth moist, eyes closed and protected. Joints through their range, and if they can move themselves, they move. Track ins and outs on the flow sheet, urine above all. Know the names Hitman and Sheep Vomit so the medic's handover makes sense. On a long hold, nursing is not the extra work, it is the treatment. Thanks for watching Module 14 of the TCCC-Plus course, Day 2, Nursing Care. Next up is Module 15, Splinting and Packaging.